the body is submersed. The body is submersed in a tank. We in Dundee did it for 6 months, but in fact, the Thai people in Thailand have found that that's too long for them, so they tend to submerge their bodies for about 3 months. And again, that's possibly to do with the heat of the country. Again, if I could remind people, please no photographs. Please don't put these on social media because our donors have not given consent for this. So here we were in Thailand a couple of years ago. So I wanted to show these photographs because it was demonstrating that it's not the UK Dundee setup. In Dundee, we've been doing teal since 2008-9. So we've had many years of actually working it up. This was done in Thailand. And as you can see, the facilities aren't yet set up this is the north of Thailand, set up for doing teal embalming. So this is us working just an ordinary room, bringing in the chemicals, using quite basic weighing machines to actually work out how we could actually put the chemicals together, and working with quite a big team of interested people who were learning how to do this. Again, we mixed our own chemicals while we were out there, and this is one of my colleagues, Attican, again with Tyler, stirring up the solutions to actually mix the salts. So again, it doesn't necessarily mean that you have to buy big expensive chemicals. You can buy industrial chemicals and make them up yourself. This was the facility where the tank, you saw our fancy tanks in Dundee, but this was just a metal tank. It has to be stainless steel that was on a balcony in the university up in Khon Kaen in the north of Thailand. So this was the tank we actually used to submerge the body, the first one we did out there. Again, that's just another picture of the same thing. This tank is just on an ordinary balcony. This is Tyler demonstrating to our Thailand colleagues how to embalm a teal body. And the first thing you do, as I say, is you make a little hole to put the embalming fluid, the venous embalming fluid, into the superior sagittal sinus. And the reason for doing that is mostly to perfuse the head, face, and also retrograde perfusion of the abdominal cavity contents. So that's why the perfusion is also done both venous and arterial. Again, this is Tyler teaching one of the Thai technicians, who was excellent, by the way, at how to embalm. So he was doing a different body. And again, you can see here, this is the fluids being injected into the superior sagittal sinus. And you can just see this other tube here that's going into the femoral artery. So the arterial solution is being infused into the femoral artery, and the venous solution into the sagittal sinus. And that means that the body is being perfused from both sides and actually will help spread this fluid throughout the body. Once that process is over, here again, we're back on the balcony with our body, and it's now going into a teal tank. And you can see the facilities aren't really state of the art yet in Thailand, but this was just something we were out there trying to teach people how to do it. And therefore, it was just an ordinary stainless steel tank on a balcony. We then, even within a couple of days, this is just Tyler and us checking. One of the things that happens with teal is that the epidermis of the skin actually sloughs off, and this process begins quite quickly. You can see the skin already starting to be removed, and here's Tyler rubbing some more skin off, and that epidermis comes off quite quickly. And over the 3 months or 2 months or whatever it is, you've got the body in the tank, that skin is removed. And this is an indication that the teal perfusion is working quite well. So we were quite pleased with the progress, even on the 2 or 3 days that we waited for this body to prepare. So how have we been using teal? In Dundee, we've been using it particularly to teach our next generation of anatomists, doctors, dentists, medics, whoever. So it's the future generation. And we found that teal was particularly useful when demonstrating anatomy to our students. So learning anatomy, obviously you can do it just with plastic models, as is demonstrated here. But what we did was we use a lot of dissection at Dundee. So students would learn their anatomy through the dissection. And because of that flexibility of the bodies, they were able to dissect very, very easily. They could see those fascial layers. It's very easy. You can pull on tendons and things move. So you get a very good sense of the functional anatomy by using teal. Additionally, we taught a few basic skills while we were doing this. So, for example, while we were doing the skin, we would teach our medical students how to suture. So it's quite fun for them. They're learning their anatomy, but they're also learning a few skills. And we all know that medical students love their clinical skills. Again, sorry, this is just a reminder in case anyone has joined us. I really don't want these to go out on social media, please. Here's a medical student at Dundee, and this time we were doing the respiratory system. So here we were teaching them the respiratory system, and one of the things they did as part of that was to intubate the patient, or rather the donor, the teal donor, and you can use that because the jaw is very, very flexible. And here's then the students could use an ambu bag to inflate the chest cavity, and you could see that the actual they could look at the vocal cords as they were intubating, and they could actually then intubate and um, use the ambu bag to make the person breathe. So it's quite a good simulation model for that. In terms of dentists, one of the things that we did with dentists was because the jaw is very, very flexible, and the body, of course, is an absolutely a real anatomical model. What we actually did there was we allowed the students to come in and they practiced tooth extraction. The other thing that they practiced, which they could do over and over again, which is not really, you can't do that with a real patient, is to practice their local anesthetic injection of the oral cavity. So they would come in and you can just keep on injecting in different areas, practicing the anatomy of anesthetic, local anesthetic for dental students. And we actually had another university from Aberdeen who used to come down and practice their local anesthetic and tooth extraction with our anatomy teal donors. And we're hoping that through this, sort of extra activities that we could do, not just anatomy, not just dissection, we were hoping that we would also have good graduates that come out of the Dundee University. We also used teal bodies for clear clinical research, and I call it solving clinical problems with anatomical solutions. And again, you can see here, this is Helen Donald Simpson again, doing some experiments and various other bits and pieces, fluoroscopy with the teal bodies. And they have some properties which are really, really useful for doing particular experiments. This was one of the early people. Andreas Meltzer was one of the early biomedical engineers who worked with teal, and he was looking at ablating tumors in things like spleen and liver. And of course, when somebody is breathing, these tumors are moving up and down, or these organs are moving up and down. So the whole point of using the simulated model here was that you could get a teal cadaver to breathe, or sort of breathe, and then they could try and see how they could ablate tumors with various techniques where they had to aim for that tumor. So intubation and ventilation was one of the early things that we did with teal bodies. Also, fluoroscopy works incredibly well because the vessels, when you teal embalm a vessel, the blood, unlike with the formalin, it completely dissolves. The cell bodies are lysed, so a lot of the blood is removed from all the organs and heart, vessels, whatever. And that means you can run fluids through arteries and veins in a teal cadaver. And that means fluoroscopy with a C-arm is possible. And here's one, for example, where we're pushing radiopaque fluid through into the kidney. And this is not a patient, this is a teal cadaver. So you can see how well it works and how you can see that lovely arterial tree in the cadaveric kidney. We also developed a method whereby you could have pulsatile flow. So it wasn't just natural flow in one direction through, or at least it was in one direction, I beg your pardon, through a vessel, but we actually used something to make it intermittent flow. So it wasn't quite physiological. It doesn't quite like the same pressure that you get in a normal artery, but this was the femoral artery. Again, Helen and Graham managed to work it so they could get pulsatile flow. So you do get some pulses with arteries, and that's very useful for people who are using medical devices, for example, to destroy arteriosclerotic plaques, for example, and they can simulate the pulsatile flow through these vessels. This is one of my favorite pictures. I know this heart valve looks a little bit manky and not particularly nice, but this is the aortic valve, and we're using an endoscope here. We're putting pulsatile flow with teal fluid through a anatomy donor body, And you can see this is the aortic valve, which, yes, looks a little bit messy because this is a cadaver, but you can see how it's opening and closing with that pulsatile flow. And again, we were working with a couple of cardiothoracic surgeons who wanted to look at how to insert a new type of aortic valve, and this allowed them to simulate the environment that they would be working under. Another one, stroke thrombectomies. Again, this is Graham Houston himself. We also worked with a person called Iris Grunwald. And what they were doing was she was looking for stroke thrombectomy. So you can go into, after somebody's had a stroke, some of the latest, some of you may know, some of the latest treatments are actually to try and go into that. And if it's a clot, a stroke with a clot, you go in and you pick up the embolus and then you take it out again. And again, this was a simulation whereby we were trying to use fake clots in certain vessels and then actually try and pull them out. And again, this is a carotid angiogram showing how in a teal cadaver, the fluid, the radiopaque fluid, flows quite happily through the carotid system, even though this is not actually a patient. This is one of my PhD students. I'd like to introduce you to a couple of the PhD students. This is Claire Fitton, who again was working with some of our colleagues up in Dundee to look at atherosclerotic plaques, and again working with a company who were using this instrument to try and drag and clear these plaques to open up arteries that were being blocked by arterial disease or peripheral arterial disease. So she, for example, took some CT scanning, also did some micro CT on sections of the femoral artery, and this is just an animation of these atherosclerotic plaques on a sort of smaller piece of the actual tissue of the femoral artery. And we also worked with some engineers, some biomedical engineers in Dundee. So Claire would take a very small piece of femoral artery, cut it into little tiny sections, add it to a little machine, and you can see there's a gel there with a little tiny piece of tissue on it. And the whole idea then was this machine, the biomedical engineers had this machine which would then vibrate that area of gel, and the movements of the tissue sitting on the gel were then mathematically calculated to investigate and to measure the elastic properties of that teal cadaver. So these little tiny pieces of tissue were put in this instrument, and the vibration of that instrument allowed us to measure the elastic properties. So it was a really interesting experiment working with biomedical engineers. The other one that I just wanted to show you was we also used optical coherence tomography. So I don't know if any of you have had your eyes tested using OCT. So it's a nice kind of scan, but it doesn't go particularly deeply. But what we were doing here was we were using a cadaveric specimen to run the OCT machine. So this is the OCT. It's running along 5 millimeters worth of femoral artery. So this is the cadaveric femoral artery, and you can see the edges of it look a little bit rough. But the idea was that we were actually measuring and estimating the diameter of the artery by running this OCT machine through it. And these other pipes here, this is just the guide putting in, sorry, that's the guide there. And this other pipe was just pouring the fluid. So again, this was flowing through the femoral artery, and the OCT monitor was actually measuring. And you can see how beautiful these pictures are. And you can see the inside of that vessel quite nicely. So again, simulating the real environment. Ikeno Ikele may be known to some of you. He was a PhD student I had in Dundee, um, absolutely from Nigeria. So he's one of our successors who has recently graduated with his PhD. Ikena's project was more to look at the effect of the thickness of the ligamentum flavum on, or as particularly functionally, during flexion and extension of the neck. So some of the early parts we tried doing X-ray. So this is an extended, it was just sections of cervical vertebrae that he was using, just sections, not the whole body. So he had a section, and of course, because of the flexibility of teal, these sections could flex and extend very nicely. So we set up initially with some sort of equipment that allowed us to extend the neck, keep it in the neutral position, or indeed flex it. And then later on, we moved on to MRI, and this is just a nice picture of the MRI. It did take quite some getting to work reasonably. But this is the ligamentum flavum here. And again, Ikenna was measuring the thickness of the ligamentum flavum and it's the difference in thickness during flexion, extension, and neutral position of the neck, because we were looking at its effect of posture on cervical stenosis, which is a reasonably common condition. And then the last PhD student I want you to introduce you is Guohao Lin. He was from China. This was actually his master's project rather than his PhD, but he was very interested in forward head posture. We know we're all looking at our phones all the time, so people forward head posture is becoming a real issue. He was a physiotherapist and he was very interested in this. And he was looking at the effect of the muscles, or what the effect of the muscles were on forward head posture and the strain that was being applied to them. So he used this instrument here, which is a microscribe digitizer, which you could very accurately measure the lengths of muscles. You can see here he's marked with pins the origin insertion of all these neck muscles. So you can see just the pins marking various vertebrae. And then he measured using the digitizer the lengths of various muscles. And he's now published this paper in Clinical Anatomy. And you can see using in forward head posture, a slight forward head posture, or in the neutral position, the effect it had on these muscles. And then he made some conclusions about which ones were being used and which ones were being used more effectively, and to prevent this forward head posture, or to keep the body in that forward head posture. So there's a paper in Clinical Anatomy that he published a couple of years ago with that. Also, we want to do some surgical skills training. Teal is very, very useful for surgical skills. And I'll just give you a few examples here. For example, here's someone learning how to do laparoscopy on a machine, but you can put a teal cadaver in that machine, or later on you can use the entire teal cadaver to put air into the abdomen. And again, oscopy of all sorts is very good. Endoscopy, laparoscopy, arthroscopy, all of these are possible with a teal cadaver. And this was a ENT group doing laser pharynx larynx course. And again, here's our patient, but our patient isn't a patient. Our patient is a teal cadaver having been operated on. I just wanted to show you this because you can see how fine the tissues and layers of fascia are. This is ophthalmology group actually dissecting out the eyelid, and you can see how fine those tissues are in a teal cadaver. And then lastly, just to show you a total knee arthroplasty, because of the flexibility of the body, we could do projects like bringing in orthopedic surgeons who are doing things like arthroplasties, shoulder, hip, knee, whatever. And then the last thing I'd like to show you in terms of medical device testing, in terms of the teal, is we did work with some companies. Now, this is a normal pacemaker. This was a sort of a new one brought in by the company Medtronic. It looks a little bit like this. So this hooks on the inside of the heart. So this goes into the right ventricle and is a pacemaker which is internal to the heart, and it's basically sending out electrical signals. And what we did was we used the teal cadavers for doctors to practice inserting the micra into a heart and then removing them afterwards. So we used quite a few medical device companies to help train them with these various devices. So the last thing I just want to talk a little bit is about, because I'm in Birmingham now, I'm no longer in Dundee, and we're bringing Teal to Birmingham in the near future. So this is just our plans, and the whole idea, we want to establish what's called the Birmingham Centre for Anatomy, Surgical and Clinical Skills, and we call it BCASKs, or Birmingham Casks, because of course we like casks in anatomy. And we're trying to do a really an exciting project where we're moving into a new building where we have both the teal cadaver, the formalin cadaver, virtual reality, and all sorts of clinical skills, all centered in one place, so we can actually give a really, really good environment for both surgical skills, clinical skills, and anatomy learning to our undergraduate and postgraduate students. So that's just a plan of the actual building. If we look at the clinical skills, we'll have simulated wards, 4-bed wards. Also, again, some task trainers where people can practice their ability to cannulate or do something else. We'll have a home environment with a midwifery bath in here, so the midwives can come along and practice, helping people delivering their babies. And there's a whole range of flexible rooms that we'll be able to use in there. Sort of a bit more exciting for me is the anatomy and surgical skills area. So we'll have a very, very large prosectorium, we call them here, a huge area here. Also, we have anatomage tables, the virtual dissectors, some ultrasound. These are 4 immersion rooms where virtual reality and augmented reality can take place. We'll have a fully fitted operating theatre together with anesthetic room and a washroom. And then this will be our surgical skills center where we'll be able to have proper operating lights and we'll be able to bring people in to do surgical skills in that particular area. And again, these are just some architects' diagrams of what it'll look like. So, there's the operating theatre, somewhere where we have a C arm. And these are the sorts of things that we'll be able to do in the future in Birmingham, which looks very bright for us. And also, again, a lot of technology enhanced education, training, immersion room simulation, but also using the teal cadaver in new and interesting ways to augment some of the other types of training that we'll actually do. So we're really looking forward. Unfortunately, we still have about a year to go, but we're really looking forward to doing some exciting things in Birmingham. So thank you very much for listening. I just wanted to say the reason we are so keen on teal is improved safety for staff and students. The level of formalin is much, much lower with these bodies. We think it gives a really enhanced experience for our students so that they come out as better doctors and dentists and physiotherapists. There are also opportunities for both research and collaborations with other universities. We now have a memorandum of understanding between Dundee, Birmingham, and 2 of our Thai university colleagues. So that's something to look forward to, and maybe there are opportunities for Nigeria as well, and also with medical device companies who can help finance things. And we think again in Dundee, it's definitely for Dundee. This we've been breaking new ground with the advanced use of the anatomy donor bodies. So thank you very much for listening, and thank you very much again to the Anatomical Society of Nigeria for inviting me. And it's lovely to be with you here today. Oh, thank you. That's very nice of you. I see the little clapping hands. That's very nice.